Hello, I'm Dr. Patrick O'Shaughnessy. Thank you for joining us for today's episode of CHS Presents Health Connect. Catholic Health Services of Long Island is an integrated healthcare delivery system with some of the region's finest health and human services agencies. CHS includes 6 hospitals, 3 skilled nursing facilities, a regional home nursing service, hospice, and a multi-service community-based agency for persons with special needs. Under the sponsorship of the Diocese of Rockville Center, CHS serves hundreds of thousands of Long Islanders each year, providing care that extends from the beginning of life to helping people live their final years in comfort, grace, and dignity. CHS has a commitment to quality, and through this show and many community health initiatives, we aim to promote good health and provide you access to the care that you may need. I'd also like to thank and recognize each of CHS's 22,000 employees and affiliated medical staff members for their ongoing commitment to quality and service excellence, which is evident at each and every patient encounter. You all are the face of CHS, and we thank you for all you do for our patients and residents every day. An increasing number of patients are requiring health care in their own home. CHS's Catholic Home Care team of more than 550 dedicated professionals services more than 2,300 patients in their residences through the Acute Care Agency, ensuring that patients throughout Nassau, Suffolk, and Queens counties continue to have their home care needs met 24 hours a day, 7 days a week. With a wide range of services that can be given in your home for an illness or injury, home health care ensures your continuum of care beyond hospital or nursing home walls. The need for this type of service just keeps growing. On today's show, we'll discuss the coordination of care with Mary Ellen Pollitt, the Executive Vice President and Chief Administrative Officer for Catholic Health Services Home Care and Hospice, and Marguerite Whelan, the Director of Clinical Information for Catholic Home Care. Perhaps you or a loved one could benefit from these services, so please stay tuned. We'll be right back with today's episode of CHS Presents Health Connect.
Once there was a boy who did the same thing again and again. One day, he was told he had autism. He got help and slowly learned how to live with it better.
Early intervention can make a lifetime of difference. Learn the signs at autismspeaks.org.
He helped me learn to read.
It is the best feeling in the world. They impact me. I'm proud of the work that I'm doing.
There's been dramatic results in our kindergarten classroom this year from having a foster grandparent.
Welcome back to CHS Presents Health Connect. Catholic Home Care, CHS's regional home nursing service, can provide you with the necessary services and support to assist you in recovering from a recent illness, a surgical procedure, or a chronic illness. Physicians, discharge planners, insurance case managers, and family members can benefit from these skilled services in their home environment. Joining me today to discuss these benefits and the coordination of care is Mary Ellen Pollitt, the Executive Vice President and Chief Administrative Officer for Catholic Health Services Home Care and Hospice. Thank you for joining us today, Mary Ellen.
Thank you for having us, Dr.
It's wonderful to have you here. Your division is really exploding along our whole integrated healthcare system. Home care services are becoming more and more important. Can you share a little bit with our viewers at home about the types of services that you oversee?
Yeah, we're really excited at Catholic Home Care as we see care moving to where we feel patients really want to be, which is in their home setting.
Right.
So at Catholic Home Care, we provide a range of services, including physical therapy at home, nursing services at home, home health aid care. We also have our social workers that work with families to look at what are some of their needs in managing some very complex cases at home. We have some specialty services we provide. We do some telemedicine, which we'll talk a little more about later, pediatric care in the home. We also do behavioral health, and we have home infusion therapy as well.
So really the complete gamut. And you know, something that was so eye-opening to me as I began to learn more and more about population health management are the social determinants of health in the home environment. Can you share a little bit about how important that is? And just by you physically being there in the home and seeing perhaps what someone may be struggling with, whether it be nutritional issues or the physicalities of the home that could create problems. Can you share a little bit about what you all do?
Absolutely, because I'm a home care nurse myself. So I started a long time ago in actually caring for patients in the home. And what you definitely see is people are really struggling in the home environment with social challenges. Sometimes it's financial.
Yes.
You see homes maybe where there's hoarding happening. And while we're watching on the acute care side to say, why aren't patients taking their medications, et cetera, the home environment could be in such a state of disarray that that's the least problem on their mind and the least thing they're thinking about, because they're really struggling on a day-to-day basis.
Absolutely.
As a home care nurse, you look for, is there food in the home? Is there a place for everyone to sleep? Is there a place to do laundry? If you're ill, are you able to walk around your home? What are the barriers? So it's certainly the social environment in the home is really telling as to someone's success following a hospitalization.
Very important picture married with their physical and medical conditions. And then you all do such an incredible job along what we call medication reconciliation and making sure that the medications that are prescribed are actually being taken in the right environment. And then also making sure that, sometimes there are natural therapies and supplements that can create problems with medications. Can you talk a little bit about your medication reconciliation process?
Yeah, we have a new program. It's called REACT. And REACT was created because what we found was patients in the home environment, and I think we all know this even from our own personal experience, taking the medications exactly as prescribed is often very difficult. Some medications are 3 times a day, some are 2 times a day, some are with meals, some you break in half. And when you're ill, to really keep all that straight is very, very difficult. So we've adopted a new process that really works with the families to create what can work for them. So we really focus on engaging the patient, engaging the family on how would they see, first of all, do they understand what the medications are for, which helps increase compliance, and also to set up a schedule that works around their time. What time do they wake up? What time do they go to bed? And to try to set up a personalized schedule for each patient that they create with us. And we found that to be very successful. Patients, as you saw our latest statistics, we were at over 90%, of our patients taking the medications exactly as prescribed, which is really quite an accomplishment.
And I love what you said, which is the key, and it's an Institute of Medicine key aim. You put the patient at the center of the care plan and engage them in the overall plan of care that you're creating. So really some wonderful services. Tell us a little bit more about Catholic Home Care. As an example, how many patients you see and the types of services that you provide within Catholic Home Care.
Well, the program has gotten quite large. We've grown from 2013, we had about 800 patients. To the present time, we have about 2,300 patients.
2,300 patients?
Every day.
Every day.
So significant growth in the program. We open new cases, probably over 100 every day.
Wow.
So the program is really quite large. We cover Nassau County, Suffolk County, and Queens. And we provide acute care services to patients who have been recently hospitalized or have had an illness. Maybe their doctor might have referred them. So hospitalization is not required.
So that's a really good point. For our viewers at home, how could they engage you in Catholic Home Care? I mean, obviously we know if they're in the hospital and whatnot, case management and whatnot may involve you, but how would this happen? How
so if you're not in the hospital, I mean, we do, the services we give do require an order from a physician, but however, you can call into our office, and with that call, give us some information about your circumstance and what you're looking for, what are your issues. And we get these calls all the time. Then we reach out to the physician, you tell us who your doctor is, and we see if the doctor would be game for us to do what's called a home care evaluation. Then we go into the home, we take a look at what's happening to you, what's been your illness history, what's your medication history, reach back to the doctor and kind of give an idea of where we feel we can help.
That's wonderful.
Sometimes it's in the area of physical therapy. People with recent falls are certainly someone who should think about, do I have some home care needs? We can look at your home and set it up to be safe for you.
We've actually talked about falls on a past show and a leading cause of morbidity and mortality. Yeah. So that's wonderful. Now, do you have to be Catholic in order to use this service?
No,
we get asked that all the time.
Yeah, we always get asked that. No, not at all. Any patient, of course, can get the services. The staff are, of course, also multi-faith themselves.
Correct.
So that's not an issue at all.
Now, you mentioned something really exciting, and I think this is where we bridge people and process and technology together to the home. You mentioned telemedicine. Share with our viewers a little bit about the telemedicine component and what you offer and how exciting that is.
Yeah, telemedicine is a great thing because what it does is it allows the patient and family to monitor certain indicators from the comfort of their home. So when telemedicine is indicated, which would be any patient with a risk for rehospitalization, a patient maybe with a diagnosis of heart failure, a patient with a lung disease, we go to the home, we set up wirelessly, we send our staff to the home. It's a wireless setup of a device that then connects to a scale, a blood pressure monitor, as well as a pulse monitor and a pulse oximetry monitor.
So literally you can get some key information, their body weight, how well they're oxygenating
Yep.
in their lungs, and that can get sent remotely back to you?
Remotely back to the office. So the staff, every morning, we have staff that are trained in the telemonitoring device. So every morning they start at about 8 o'clock and they look at everyone who's monitored. People who have monitored and have abnormal results shows up in a chart as red. People who are approaching abnormal results, it shows as yellow. And then from there, they're able to triage and look at what are they seeing,
Perfect.
reach out to the patient.
Perfect. You're speaking my
Sometimes
language.
it's a simple matter of testing again. Maybe they tested holding something, so their
Right.
weight looked higher.
Right.
Might be something that basic.
Right.
Or perhaps there really is an issue going on. So they'll have them test again. Then depending on what they see, if it's something that needs follow-up, we'll send a nurse to the home to really evaluate face-to-face what's happening.
That's wonderful. So what I like about what you said is really a triage-based system. So
Yeah.
you're able to identify people when there is an issue in the kind of the red category. But even not yellow, once you start seeing
Right.
those trends in
Yes.
the wrong direction, that's where you can intervene and perhaps make a difference and avoid someone decompensating and needing to go to the hospital.
And what's been the best thing with it is the patients really learn from it. So maybe the night before I'm a patient, I had a lot of Chinese food.
Yeah,
And I see the next morning my weight is higher.
correct.
The nurse will say, what did you eat for dinner last night? And you say, well, I had Chinese food. So now they're starting to, it's like self-education.
That's right.
Because they see in real time the impact of certain life behaviors and what it does to your body and how it's so important.
It's incredible.
And it really makes patients comply because now they've learned it for themselves.
Absolutely.
Instead of just being dictated information, don't eat this, don't eat that. They actually can see and they learn. So it's really a great patient education tool.
Well, you know, that service and the whole agencies in which you run are so vitally important for our integrated healthcare system. And as healthcare is continuing to shift, as you mentioned, out of the hospitals and into the home, being able to provide these services are vital. And we're seeing this now along multiple episodes of care from our surgical patients, patients with chronic disease. And you're doing such great work to help keep people healthy and keep them home with their families and providing that in the comfort of their own home. So I can't thank you enough
Well,
for
thank
joining
you.
us
Thank
today.
you for having
It's wonderful
me
to having you
and
here.
allowing me to talk on this topic, which is so passionate to me.
That's great. Thank you so much.
Thank
Maria.
you.
We'll be right back.
You can't text and pay attention to the world around you, and you definitely can't text and drive. Every year, deaths due to distracted and negligent driving are increasing. In fact, while drunk driving rates have dropped greatly, negligent driving fatalities have skyrocketed. Find out more at negligentdriving.com.
Welcome back. Today on CHS Presents Health Connect, we have been sharing the benefits of Catholic home care and how these services and programs can help to improve quality of life and independence. With me now to continue our discussion is Marguerite Whelan, the Director of Clinical Information for Catholic Home Care. Thank you so much for joining us today, Marge.
My pleasure, thank you.
It's great to have you here. Home care services are really exploding throughout the CHS system and throughout healthcare.
That's true.
Why do you think that is?
Well, there's the changing climate of healthcare these days with the focus on what is happening in healthcare outside the four walls of our hospitals and
Yes.
nursing homes.
Yes.
It's just such an exciting time to be in home care and a great way to extend the reach of healthcare services into a patient's home. I find that a patient's home is often the ideal environment to provide healthcare services.
Yes, I would agree with you there. For our viewers at home, what could you share? What could a patient expect? I'm sure you know patients. I think of my own mom and dad, and they love their independence, and the thought of having someone come in the house and monitor them and make sure they're taking their medications or getting their meals at first could be a little daunting, but there's just such huge benefit to this as people get on in age, or if they have chronic disease. What can families and patients particularly expect?
Well, it starts really at the time of referral. When a patient is in the hospital and they are referred to home care, we have a home care transitions nurse who actually visits them in the hospital before they come home. So it's a great way to allay some of those fears, tell the patients what to expect from home care, give them an opportunity to ask some questions. And then once they're home, sometimes the same day or at the latest the very next day, there's a nurse in the home to, again, introduce home care, do a full assessment of the patient, and really talk about some of those issues that you've just touched on, that there might be anxieties about coming home and having strangers in your house, things that they were not accustomed to before. But I think more often than not, what happens is the patients are really put more at ease once a home care clinician comes into the house. Because things that might seem very routine to a nurse or a therapist, like giving an intravenous, changing a wound dressing, providing physical therapy, those things can be quite overwhelming to a patient who doesn't have experience with that. So the anxiety over the strangers coming into the house quickly fades, we find, once they know that we're there to help them and develop really a plan of care that suits their needs.
And they build wonderful relationships with the patients, who I know wind up really relying on them. And
they do.
It's a key bridge that, I think it addresses such a big gap in healthcare, right? Because traditionally we were focused on the four walls of the hospital, and really taking now the aspects of care to the home to provide integrated services are so important. With that being said, what type of specialty services do you offer? Can you talk a little bit about things like maybe infusion, or we've talked a lot about chronic disease, but what about in pediatrics? Anything for kids here?
Yes, we do. We have staff who are specially trained in pediatrics, so we are able to see patients at home who have acute illnesses or chronic long-term illnesses, our pediatric population.
So all ages?
All ages, yes. You mentioned our infusion program.
Yes.
We do have nurses who have IV certification who provide infusion therapy at home, which is really so important because in the past, patients that needed infusion could spend days or weeks on end in a hospital to get that, but that all is provided at home. We also have a behavioral health program.
Let's talk a little bit about that, because when you look at both community health needs assessments for Nassau, Suffolk County, and even into Queens, behavioral health in the ambulatory setting is an area that's underserved. We don't have enough access. What kinds of things could home care personnel help on in this area?
Well, we have, again, staff who are trained in behavioral health, and oftentimes unmet behavioral health needs impact the patient's ability to follow up with their physician, comply with their treatment plan, take the medications that they need. So it can be something like depression or anxiety, and these nurses are very highly trained and well suited to pick up those issues and help patients to make that transition back to home, and also set them up with services in the community that are much needed.
That's excellent. So really helping on transition patients. And that was going to be my next question. Can you talk a little bit about how Catholic Home Care coordinates care and really helps on a transition basis, working with patients between, say, acute care and the continuing care division?
Yes, that's where home care staff are really experts. We've been doing this for a long time. And as I said earlier, the home care begins right in the hospital with the home care transitions nurse. So right from the get-go, that nurse has access to all the patient's information so that they can make sure that the next provider, being the nurse who comes into the house, has all the information that he or she needs. And then furthermore, they use what's called they use a laptop computer. So at the point of care, every clinician has all the information, so they have the right information about the patient at the time that they're taking care of them. That helps us in coordinating care. Also, beyond just the home care clinicians, the staff will make sure that the patient's care is coordinated with their physician so that we can monitor a patient's response to their treatment plan and follow up with their physician accordingly, and make sure that they see the doctor when they get home from the hospital. That's an area where sometimes patients are not able to get to the doctor, and home care is key in helping them get to the physician.
That's wonderful. So Marge, tell me more about telehealth.
Sure. Our telehealth program is a way that we bring technology into the patient's home, and we also are really able to extend the reach of healthcare even further because we can monitor patients when the nurse or therapist isn't in the home. And what I mean by that is The patient will be taught how to monitor their vital signs or their weight, and they transmit that information really right through their telephone lines to our telestation in the office, where a nurse monitors the patient every day. They can see if anything is abnormal, and they respond to it right away. I think Mary Ellen also mentioned earlier when you were talking that it's a great learning opportunity for patients.
Well, they get to be more involved with their care, so they know what signs and things may make their symptoms worse.
Right, exactly.
So eating a salty meal or what have you.
Right, and it even alerts us when a patient doesn't test, because sometimes that's a sign that something is wrong, and we respond to that immediately as well. So in addition to the telehealth, we have other technologies. We talked about the laptop computers that the nurses use. So our professional staff have access to all of the information, medications, the other services that are being provided right at the point where patients are being cared for in their home. And we also have a mobile phone application. It's called Mobile Light, and that's for our home health aide staff. So they are able to receive the instructions from the nurse or from the therapist about what they need to do for the patient.
So that information that gets tabulated then gets sent to the nurse via mobile technology,
Right.
So they can enact that plan.
Exactly. So it's a two-way communication. They get their instructions and the plan of care from the nurse, and then they're able to document and write on that mobile phone, and that transmits right back to the nurse, so that we know in real time how the patient is doing and what services we've provided.
Wow, that's incredible. So
It's
really,
really great.
again, integrating the best technology with the best people to provide the best outcomes. If you had to give one last point to the viewers at home about home care services, or about perhaps when would be a good time to start home care services, because a lot of times I find, or I did find as an emergency room provider, I would see patients have a complication of care that I say, well, if they were on home care,
Right.
they may not even be in here. What's the message to get out to the viewer at home about the service?
Well, I would say that certainly any time you've had a recent hospitalization, that's an optimal time for home care. But also, if a person is having safety issues at home, perhaps frequent falls, if they're needing to be in the emergency room often or have frequent hospitalizations, those are all signs that home care is needed. If you have chronic illnesses that you need to manage, or comorbidities, or which we call multiple diseases that you're managing at one time, those are all key times to contact your doctor and ask about getting home care services.
That's wonderful. Well, I can't thank you enough, Marge, for being on today's show and for sharing with our viewers the wonderful breadth of service that Catholic Home Care provides. And we see the value in what's delivered to our patients every day. So I can't thank you enough. We'll be right back. Hi, so I'd like to share some final thoughts on today's topic for our viewers at home. You've heard the team from Catholic Home Care describe and share some of the incredible services that our home care network provides for patients in their home. And really what this embodies more than anything is that healthcare is shifting from outside of the four walls of the hospital into the ambulatory space and right into our patients' homes. With new technology like telehealth and remote device capability, we're able to track vital signs, track some key symptoms and parameters that would allow us to intervene sooner and keep you healthier and perhaps even keep you out of the hospital. It is vitally important that you know when to involve these services. So many times as an emergency room provider, I would see someone come into the emergency room with a harm event that many times could have been prevented. They either had a fall at home, or they were not taking their medications, or there was a nutritional issue that was going on in the house. So many of these can be prevented with the proper interventions, and that's really what Catholic Home Care could provide. And now for my health tip and solution. As I mentioned before, I was an emergency room provider, and patients would ask me all the time, can you be my doctor? And I would always say I would like to hopefully never have to treat you again, because if you're here, it means something's gone wrong in the emergency room. So the goal for this show and perhaps this segment is to give you some tips and tricks that will keep you out of the emergency department. One thing I did want to stress on today is, and we talked a lot about navigation for health services, but also navigation in general can be a real risk. And I mean motor vehicle traffic and the potential for trauma in that area. In all of our emergency rooms, we still see a tremendous amount of motor vehicle collisions and accidents creating significant harm. And unfortunately, when you look at the statistics from the Center for Disease Control, over 30,000 people are killed in motor vehicle collisions each year. New York State has its fair share of those events. Our roads are congested, people are busy, and unfortunately, up to 10% of those incidents are due to what we call brain distraction syndrome. And guess what's some of the most common culprits, folks? It's devices like this. And that's why, fortunately, with some passage of new legislation around obviously mandating seatbelt laws, which can reduce mortality by 50%, and also non-texting laws also have made a huge impact in this public health issue. I will tell you, though, that interestingly, when you look at some of the literature around brain distraction syndrome, just having a hands-free or Bluetooth device may not even make that much of a difference. And what I mean by that is there's now evidence to show that even if you are hands-free, the distractions created by multitasking on your devices while you're driving a car could set you up for a serious injury. So what's my tip? Take the device, shut it down, put it in the back of your briefcase or your purse, and put that behind your driver's seat. Why do I say that? Because I've seen too many times when you go and you look at a car that was involved in a motor vehicle accident, that front passenger seat looks like an office desk. What's on there? A sandwich, the cell phone, some papers for a meeting. Put it all away. It could wait till you get to your next location. And that's my tip. If you'd like to know more about Catholic Home Care or to make a gift in support of this or another program that is important to you, please visit chsli.org. From there, you can click through to the websites of each of our healthcare partners for more information on ways to give. We are always grateful for the community's support because your gift today helps shape the healthcare of tomorrow. Thanks for watching today. If you have any medically related questions you'd like me to answer on future shows, please email us at healthconnect@chsli.org. Please include your name and a way to contact you in case we need to reach you. I'm Dr. Patrick O'Shaughnessy, and I hope to see you next time on CHS Presents Health Connect.